Hello guys, good afternoon. It is Dr. Pierre. I'm actually recording this in the morning. I discussed that I won't be here for a Facebook Live, but I still wanted to reach out and make sure, I did provide a lunch and learn video for you guys today. Introductions, Dr. Pierre, board certified internist, founder of drpierresblog.com, as well as author and speaker. Today we're going to be talking about what should we be doing a regular checkup. And of course, this is something that holds very near and dear to me because being an internal medicine doctor as well as primary care physician, this is pretty much my bread and butter. From a clinic visit standpoint, it's something that we try to bring home constantly, and it's something that even has gotten to the point where insurance companies and the government are really trying to push in the guise of preventative medicine, which is a misnomer, but whatever. That's okay. We'll deal with it as such. So let's talk about your annual visit and your wellness exams. I want to break it up. First, I'm going to break it up versus male and female, and then we're going to break it up in old people versus new people. And in this scenario, again, forgive me if I upset anybody, old is going to be over the age of 40, and young, obviously, is under the age of 40. So let's talk about my gentleman. My young gentleman under the age of 40, what should you be expecting during your annual wellness visit? First things first, I like to, get some standard blood work. I like to, check kidney function. I like to check liver function. I like to check cholesterol. Cholesterol is a big thing for me, especially if you're over the age of 30. I want to make sure, your cholesterol is doing well, because even though it may not cause any medical issues, at your early age, it's definitely something we want to be aware of. Going on further once you do get quote unquote older. Check a urine. We always check a urine, and the reason why we like to check the urine, it's one of the most simplest tests, but gives us a lot of answers. In your random urine test, I could see if you're having issues with kidney problems. I could see if you're going to be a diabetic. I could see if you're having an infection. So that general urinalysis test, that the peanut cup, is very important for us. So definitely urinalysis as well. So that's pretty much, and then because you're young and you tend to be more sexually active, I do always recommend getting an STD screening. When I say STD screening, we're checking for HIV, we're checking for chlamydia, gonorrhea, we're checking for syphilis, and we're checking for hepatitis. Now, your STD panel doesn't have to include all of those. I think the big ones for me are HIV. I think you should do that once a year, unless 100% know you're in a committed relationship and you're monogamous in itself, as well as at least chlamydia and gonorrhea, especially from a symptom standpoint. Those other ones usually may not present any symptoms, so that's why at least if we had to just choose one test, the HIV would be one. So now let's talk about my older gentleman. This is over the age of 40. Once you get to this point, that's when we start being concerned about the prostate, especially in a population that I deal with heavily, African Americans. Prostate cancer and the severity of it is real, and it's definitely something that we're a lot more cautious with, or a lot more aggressive with in my African American community. But in communities in general, once you get over the age of 40, and there is some controversy on this, just depending on who you ask, depending on what they like to do. But I like to check a PSA, which is your prostate specific enzyme, just to see if there's any concerns that I need to be worried about. There's lots of causes why you may have an elevated prostate. Of course, cancer being always a concern, infection always being a concern as well. So definitely want to make sure, once you get over the age of 40, PSA is one of the first things I like to look at going forward. And then as well as including all of those other blood tests like we discussed before, diabetes, cholesterol, thyroid panel, in that regards. And if you're over the age of 50, that's when we really start talking about colonoscopy, which I know men and women, absolutely hate the idea of it. If you don't know what a colonoscopy is, maybe we'll discuss that later. Let me know in the comments. But it's definitely something that needs to be done, over the age of 50, as long as you don't have any relatives who suffer from colon cancer at an earlier age. Now let's move on to my women who are, again, under the age of, my young women under the age of 40. The big thing kind of stays the same in terms of blood work. diabetes, checking for cholesterol. We like to check for kidney function, check for liver function. And a big thing, I'm an internist. I didn't do women's health during residency. Well, I did a 1 month of it, but I didn't really do women's health during residency. I went into internal medicine to kind of avoid dealing with much women's health, aka the pap smear. Not to say I couldn't do it if I, had a gun to my head. I just don't want to do it. So definitely for my women, I always recommend, when you come to see me, when you do your blood work, I'm gonna make sure you're seeing your OB as well to get that wellness exam. And going to my older women, once you hit that age of 40, again, these are, and when you'll hear us talk a lot about ages, especially like 40, 50, and this is if your family history is okay. Now, there are some caveats where, if you have family members who suffer from colon cancer, breast cancer, at an earlier age, that we do kind of push these timetables up. But for now, we're going to assume all the family's okay and you're just going in for your wellness visit. You don't really like to see the doctor, but, your significant other forced you to go for that once a year visit, so this is what you do. Once you get over the age of 40, we always recommend a mammogram. Starting out, lifesaver, again, breast cancer being the top causes of death in the United States, so definitely early screening with mammograms is much imperative in that regard. So definitely once you get to the age of 40, again, barring any family history that may cause us to start otherwise, definitely want you guys to get a mammogram. And the same thing, once you guys get to 50, we want you make sure you're getting that colonoscopy as well. And I speak to the general, like men and female, but honestly, I'm really looking at our guys here because we tend to lack behind taking care of ourselves from a healthcare standpoint. I actually have an article, I believe it's coming out, next month regarding men and their health care and why they don't like to go see the doctor. So please be on the lookout for that article as well. It's going to be very exciting in that regards of reasons why I feel they don't want to go see the doctor. But moving forward, in general, just miscellaneous things I like to check for during my wellness exam, especially for my younger patients, making sure they got their eye exams, making sure, they're stress-wise. Of course, with my wife being a licensed mental health therapist, I'm very, very, very interested in the stress component of my patients on a day-to-day basis. So I'm always asking about any stressors that may be bothering them. So definitely want to make sure stress levels are doing well. Definitely want to make sure there's no, again, I got glasses, want to make sure there's no vision disturbances, vision complaints, something that we can address. For my older patients, again, vision's a big one for making sure they have an appetite, their diet is something I like to stress in general. And especially my older patients, my pushing 60, 70-year-olds, I definitely want to make sure I help reduce as much fall risk as possible. Because a patient of mine, especially elderly patients, falling is never a good thing. Never a good thing to end up in the hospital for a fall, for a broken hip, broken shoulder, broken anything in that regard. So definitely something I always address during all my wellness exams. So again, first of all, I want to thank you guys for watching the video, especially if you stayed around this long to watch the end. I want you guys to again check out drpierresblog.com, sign up for my email list today. In fact, if you do, let me know in the comments that you signed up. I do like to keep you guys in to know. I send my blog posts directly to you guys. I'm working on some freebies that I'm going to start giving out probably around Christmas time and then all through the new year next year to make sure you guys are well up to date as far as your health care is concerned and just in general in the life of Dr. Barry. Again, Dr. Barry, board certified internist, founder of drpierresblog.com, author, speaker, bringing you another edition of the Lunch and Learn with yours truly. You guys have a great and blessed day. Bye.